and welcome to the AIHM Friday Wellness Webinar. We are just thrilled today to have two incredible guest speakers, Jaclyn Chasse and Tom Blue here, and we're excited to get into their presentation. Can you share the slideshow, Jess? Real quick, we just want to let everyone know that the contents of this video are for informational purposes only and are not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding a medical condition before undertaking any new medication, diet, dietary supplement, exercise, or other health program, or making any changes to your medications. Neither AIHM or our featured presenters and practitioners are responsible for any adverse effects resulting from your use or reliance on any information contained in this or any video. AIHM does not endorse or recommend any specific health providers, products, or services, or other items that may be discussed or mentioned in the video. Next slide. So for those of you joining us for the first time, AIHM, the Academy of Integrative Health and Medicine, is a global interprofessional integrative health association working to transform health care, body, mind, spirit, community, and planet. And we're just really excited to bring together the integrative health community in a meaningful way during these times. So our special guest today is Dr. Jaclyn Chasse. Jaclyn is a naturopathic physician. She is the Vice President of Medical Education at and Wellevate at Emerson Ecologics. She's an expert in integrative and functional medicine approaches to infertility in North America, and she earned her Bachelor of Science degree in biochemistry and molecular biology from the University of New Hampshire. She received her Doctorate of Naturopathic Medicine from Bastyr University in Seattle, Washington, and pursued advanced training in the areas of women's health and infertility, including advanced training in Sydney, Australia. She previously served as the president of the New Hampshire Association of Naturopathic Doctors, and she's currently on the editorial board for the Natural Medicine Journal. She's a volunteer and founding board member for the Manchester Food Co-op, and also volunteers in her own local community. She has 7 wonderful children with whom she loves to spend time traveling, boating, mountain biking, hiking, skiing, cooking, and gardening. So she's not very busy. And I just am so thrilled to have you here today, Jaclyn, and you as well, Tom. We're excited about your presentations. So I will pass it over to you all.
Wonderful, thank you so much. So Tom's gonna be managing our presentation today, but while we kick off, I just want to start by recognizing that this, 2020 so far has been an incredibly tumultuous year for integrative healthcare. When COVID hit, some people closed their practices, other people shifted to telemedicine, other people had to be home with their children. The number of needs from our patient perspective and our own personal lives skyrocketed. And really, we care so much about the integrative healthcare community that we knew we wanted to do something to help, anything that we could. Emerson launched a page called Pivot Your Practice, which the website is noted in the chat box, so everyone can take a look at that. And really our goal was to, as quickly as possible, put out resources that would help practitioners navigate this tumultuous time. Everything from, you'll see interviews that are a little outdated now. There are lobbyists looking at PPP right as it was passing on how to take advantage of that, and resources from a marketing perspective of how to stay engaged with your patients. We talked with marketing experts in integrative medicine about what communication methods you should be using and what you should be saying to your patients. And when we met up with Tom and saw what he was doing with virtual practices, I got so excited, and I knew that we had to create a partnership with him to bring what he was working on to integrative medicine practitioners. And that's why I'm so excited that Emerson is giving this time and space today for Tom to really share this resource with you, because it is amazing. Like, honestly, it's mind-blowing. even since the first time I saw it, and he's continued to add to it, Tom and his team. So if you want to advance the slide, Tom. Tom Blue is, we can go back to your beautiful picture if we want to allow people to see that. A lot of you probably know Tom, at least by name or by face. He's been very heavily involved in growing integrative medicine for decades. And he was a huge founder with AIHM. He spent tons of time with them, but also has done incredible amounts of consulting with organizations, with businesses, tech startups to supplement products. He really has a level of expertise. And I would say through his experience, he has a very deep understanding of practitioner needs. And so the virtual practices, almost was a natural flow from him. And I'll let you, Tom, kind of take it over. I'm sure, you're going to want to stay tuned to the end, because once you see all of the different resources that are in here and it's free, you're going to want to connect and get more information. So please take it away, Tom.
All right. Well, thank you for that. And it's a humongous pleasure to be here with all of you. As Jaclyn said, this is the Virtual Practices Initiative was something that a group of colleagues and I put together as a rapid response initiative that wound up drawing in collaboration from nearly 24 different companies across our ecosystem, and actually in some places beyond on the technology side. And what I think what I want to talk about today is, and this is sort of an overview of a deeper topic, and it's followed by a series of 4 other workshops that we're doing with Emerson. But I want to talk a little bit about what we have been taught by this COVID crisis, and both about practices, about patient engagement, practice fragility, and how we can kind of take those lessons, apply them, and move forward in a way that was better than we began. And I think that hopefully by the time we finish this conversation today, you'll conclude with me that actually is not a far-fetched aspiration. So to get started with this, I want to start with a question that will seem completely unrelated to the subject at hand, which is, why is air travel as safe as it is? And in a moment, I'm going to link this to COVID and what we're learning about medical practices. But air travel is a rather remarkable thing. And we've got, on any given day prior to COVID, there were like 87,000 flights zinging over the United States in all varieties of weather and wind and thunder and lightning and different airport conditions, et cetera. And yet the odds of you being in a plane crash are so unbelievably low that it's barely worth doing the math. It's something like 1 in 5.4 million of even being in a plane crash, much less dying in one. And it begs the question of, how in the world did they get that way? And what's fascinating about the airlines is they have developed an ability to take every single failure or even near failure and suck every last drop of learning out of that failure and applying it going forward, to the point where they are, in context of safety, they are literally fed by the ever so rare kind of tragic event, to the point where they get stronger and stronger as a result of every failure. And so what I want to propose to you all is that we should, in a way, kind of look at this COVID crisis as it's impacted us, as Jaclyn was saying just a moment ago, and see if we can find the black box in our practices and extract every drop of learning that COVID has had to teach us about what makes a practice fragile, and is it possible to create something that is the opposite of fragile. So to embark on this conversation together, I want to introduce you to what may be a new word, which is arguably the polar opposite of the word fragile. So a few years ago, a book came out. It was called Anti-Fragile, and it was really a brilliant piece of work. And the author was attempting to describe a particular system that occurs in both nature as well as in business, that unlike any other is actually fed by external stressors, disruptions, failures. Think in the world of biology, think of a muscle. How do you make a muscle stronger? well, you break it down and it repairs itself stronger, bigger, better than it was before. So a muscle is a perfect characterization of the word anti-fragile. It's not robust in that it's a bit more resistant to external stressors until finally it breaks. It's not just resilient in that it can return to where it was before, but actually the product of external stress makes the muscle stronger and better than it was before. And so what I want to propose to you all is that it is very possible that what we've witnessed in the, from COVID, and what if we take the learnings of COVID and really apply it, that we could create, in a sense, anti-fragility in functional and integrative medicine practices. So I'll put forward now a thesis for this conversation, which is I have concluded that any scenario where human health is threatened by a new and unknown condition and access to healthcare is obstructed should work to the advantage and not the detriment of a functional and integrative medicine practitioner. Now, why do I say that? Let's start with the threat to human health. Let's look at COVID. We've got a new infectious disease that has no cure, no vaccine. What is the highest value application of healthcare to a consumer, to a patient in this moment in the context of COVID? Given that there's no known cure, given that there's no vaccine, the highest value thing that a healthcare practitioner can do is to essentially reinforce host defense, to build the immune system of a patient, to teach people to use nutrition, lifestyle, tools at their disposal in a way that's personalized to them, to make them more resistant to the virus, to blunt the effects of the virus should it happen. This, I would submit, is the highest value application of healthcare prior to someone being hospitalized. Now let's talk about the obstruction of access to the healthcare system. And I would challenge you, if you held aside for a moment maybe mental health, which obviously lends itself beautifully to virtual care, thinking of all of the possible ways of managing health, I would struggle to think of one that is better suited than functional and integrative medicine to the remote management of health. It's a consultative modality that enables people to sort of empower themselves while at home and while unable to come into face-to-face contact with the healthcare system. And I would therefore argue that the highest potential value providers and creators in the healthcare workforce today are, in fact, those who have invested in and gotten trained in functional and integrative medicine. And so for that reason, I think that we can do the work of modifying a practice design such that, in fact, the next wave of this, should it come in the fall, is actually something that will elevate these practices in the eyes of the public and in the eyes of your own patients as the highest sources of value in the healthcare system as this pandemic unfolds. So let's now unpack some lessons. So as I've tried to sort of fetch the black box and pull it apart on the topic of COVID and the havoc that it has wrought on practices around the country, there are many, many lessons to be learned, but I tried to cull out the 5 that I thought were the most relevant and important for this conversation. And I'll start with a simple one, which is the lesson that says anticipate disruption. So it serves no productive purpose for us to beat up on ourselves for not predicting, the COVID pandemic and proactively avoiding the chaos that it's created. But at the same time, I will say shame on us if we don't anticipate that this is not over. And if not later this summer, in all likelihood by the fall, we're going to be experiencing a recurrence and possibly many more recurrences of just these cycles of distancing and containment measures that, if we don't do anything, we'll only have the same effects on practices over and over. So number 1, we have to anticipate disruption in the future. Number 2 is a lesson I'm calling acknowledging trends. So if you look at what has changed in the world as a result of COVID, and those changes that will likely last, that won't fizzle out as whenever COVID kind of has been resolved, those lasting changes actually were not set in motion and catalyzed by COVID. They were trends that were well in motion prior to now, and that COVID just radically accelerated. And so, for example, the trend towards telehealth. I've said a number of times now that COVID accomplished in only a few months what would have taken us, 10 years or more in lobbying in terms of sort of smoothing the roads in front of us for doing telehealth and the interstate practice of medicine, the financial reimbursement for telehealth for those that are contracted with payers. I mean, just remarkable advancement in the world of telehealth as a result of COVID. But that's hardly a movement that had not been set in motion many years before COVID ever landed on our shores. Second trend, health moving to the home, which is a hugely relevant topic, both for our discussion here as well as in some of our follow-on conversations in these workshops. But this concept of health moving into the home and the patient being empowered to take on responsibility and be very active in the management of their own health is a trend that's been underway now for both culturally as well as technologically, as well as from a regulatory standpoint for a number of years now. Of course, COVID, by obstructing access to the healthcare system and forcing people to start thinking about their own sort of immune health, has dramatically accelerated it. A companion to that is the digital health revolution and remote monitoring. Again, it radically accelerated as a result of COVID. And then finally, the virtualization of work, which I raise only because we have to remember that practices both exist in service of patients, but are also businesses that have a staff and a workforce. And so recognizing the potential and the need to optimize virtual work environments for even the small staff of an independent practice is going to prove important. The third lesson is what I'm referring to as adaptive practice design. So this is a term that I sort of borrowed from the world of web and interface development, where, as you probably have seen now that we all have mobile phones, many websites, as you crunch them in, they just sort of reconfigure themselves. And so they're adapting to the device that you're looking at it through. And in much that same way, or in the same way as this transformer kind of metaphor that I'm also using, is sort of moves with its circumstances. We need to, and I think can very much aspire to create practice infrastructures that evolve and morph to reflect the circumstances of the moment. So as a practice, as we're clamped down and shut down, the practice can morph and provide service uninterrupted, more or less, and a value proposition that's uninterrupted to patients, regardless of circumstances. And so developing this kind of adaptive designed practice infrastructure is going to prove to be a big deal. Now, this one is a big deal as well, and it's something that I think COVID has done a spectacular job of really exposing, which is the fragility of different revenue models that we see commonly applied in functional and integrative medicine. And so I've kind of laid this little staircase out, to reflect the three most common kind of approaches to the financial relationship between patients and practices. The first, pay now, it sort of reflects the concept of the cash fee-for-service, pay-as-you-go kind of a model. Could be could be even insurance-based fee-for-service, pay-as-you-go model. So that's a revenue model, number one. Number two, sign up is in my way of thinking that's sort of practices that are applying packages and programs that are maybe time-bound. I'm going to have a 6-month reverse your diabetes program or what have you, so the patient signs up for that program. And then the third is a subscription, which comes borrowed from the world of concierge medicine or direct primary care, where there's a membership kind of model that the practice lives by. Now, given these three possible revenue models, think for a moment about which one has been proven to be the most fragile in the context of what we've experienced with COVID. And of course, the answer to that is the pay now, pay as you go. Most practices, in a situation like this, are sort of looking probably rather enviously at those that have subscription models that keep revenue kind of coming in the door, in these odd circumstances. Now, I want to dive a little bit more deeply into this topic and not just think about it through the self-centered, self-interested lens of the practice, but to think about the psychology of the patient as a participant in any of these three models. So if you are a patient of a membership practice right now, and COVID hits, and you now have your access to the medical practice has been obstructed, what is the question on your mind? The question likely on your mind is, well, in light of the disruption of COVID and I can't access the practice, how do I continue to get my money's worth out of this membership? So that's, it's the logical, self-interested question that any consumer would ask if they're a part of a membership practice. If you're in a sign-up model, if you're participating in some care pathway or episode of Care Now, the same kind of question occurs to the consumer. It's like, okay, things are disrupted. How do I make sure I haven't wasted my investment in this program, in what we're experiencing with COVID? If you're in the pay now model, pay as you go, well, I mean, and now COVID occurs, you don't have that, the model doesn't prompt you to inquire as to how do I continue this relationship. Instead, this model, it kind of leads you to inquire, well, how do I get by without going to the doctor's office? And so you can see how this circumstance that we've witnessed with COVID exposes the fragility of that model in particular, and kind of invites us to consider how to apply different ones. Now the sibling to what I just described in the way of fragile financial models is the fragility of engagement models. And if you consider, I've kind of put graphics here to represent two forms of engagement. One is, at the bottom, you've laid out a sequence. There's a clear pathway. The patient that knows that they are in a program and it has a destination. Again, in the face of disruption, the first question that patient would ask is, how do I navigate current circumstances so as not to take me off course for where I'm trying to get with my health? The alternative to that is at least in the mind of the patient. I'm not suggesting that you as the practitioner don't know where you're leading all of your patients, given their various health objectives, but I would challenge you to reflect on how clearly does the patient understand that pathway, and do they more or less perceive that their care path is being built as it unfolds, as they book visits with the office, they come in, they have a test, another leg of the path or another brick is put into that pathway, and it's kind of unfolding as it goes. That is an engagement model that's very fragile in a situation like this, because it's so easy to interrupt it. Whereas when the patient can see the destination very clearly, they're much more inclined, again, to have their first inquiry being, all right, how do I not get off this path? And so what I'm going to propose to us is that we want to build practices and that capitalize on the training that you already have, that can gain from the disorder that's been created by COVID and may be created in reverberating cycles over the course of the next year, 18 months, or even longer. And so the 4 steps to accomplishing this, in at least in my way of thinking, are: number one, to create and implement what we would refer to as a COVID era infrastructure. And I think that it's not inappropriate at all to be thinking of the times that we're in as the very beginnings of what could be considered the COVID era, given all of the newness of the way that our lives work, our businesses work, and healthcare works in this window of time. And as you'll hear, and as we dive deeper into in the workshops that follow, this is not simply a matter of acquiring a telehealth tool or subscribing to Zoom so that you can conduct a virtual visit. The second is to establish relevance to COVID-19. It is, in my opinion, just the pinnacle of tragedies to have arguably the greatest potential value creators for patients that are not yet in the hospital, as far as healthcare, that kind of the healthcare talent pool, that being functional and integrative medicine practitioners, sitting on the sidelines waiting for this for this crisis to resolve, simply because they haven't found their own relevance to this. They've been maybe sort of put off, and it's understandable that they would think, or you would think, that this is an infectious disease. I'm used to talking about a sweet spot, which is chronic disease and chronic disease reversal. This is a highly contagious disease, and I'm used to dealing with patients that aren't contagious, and I'm not equipped to safely deal with contagious patients. So given those two things alone, it would be very easy to sort of dismiss yourself from relevance in this crisis and not recognize, in fact, that you actually have an enormous amount of value to both contribute as well as to capture in return. Third would be then using COVID to establish an anti-fragile revenue and engagement model. So correcting those things that have revealed themselves to make practices particularly fragile in a time like this. Completely correctable, by the way. And then finally, is seizing this moment. And I would say by this moment, I mean like over the next couple of months, to relaunch, re-engage, reignite the practice, redefine a bit of the expectations with patients, and possibly even pursue some new frontiers of growth in your own community with that we'll sort of unpack a little bit as we talk. So let's talk for a moment about relevance. And I want to sell you, if I can, on the idea that you are actually entirely relevant to this crisis in a way that is glaringly apparent if you just sort of step back and look at what's going on and what has gone on. So for me, I get home for whatever reason now that I'm trapped in Richmond, Virginia in the COVID crisis. I show up at home at night and it seems that CNN is always playing, and I have now gotten to know this guy who I'd never even heard of prior to COVID, called Chris Cuomo. And so every evening I'm watching him. He's talking about COVID, yada, yada. He's talking to Sanjay Gupta here, the CNN doctor. Well, lo and behold, he gets COVID. And we get a window into the world of a guy who is actually suffering this, from this infection. And he, while he never winds up hospitalized, he really did struggle with it. And he's sweating and he's having fevers and nightmares and hallucinating and what have you. And he tweets kind of, a good ways into this, this health crisis. He tweets, "I'm sick of being sick. I've had it. I want to get back to work, but I'm not ready. I don't have a plan to be ready." And I saw this and I thought to myself, herein lies a perfect illustration of the value differential between functional and integrative medicine and the best of what conventional medicine has to offer in this, a patient in this circumstance, stuck at home. The best advice that conventional telehealth providers even will provide is stay home, stay isolated, stay hydrated, and try not to freak out. And the protocol for a teledoc or a doctor on demand is literally to provide what Sanjay Gupta was providing every night on CNN, which is essentially what literally they call comfort calls. It's the don't freak out part. And so if you kind of contrast the advice that you have got to give and probably have already dispensed in the form of emails and newsletters to your patients about how to support their own immune system, support their own health, modify their lifestyle in quarantine to either blunt the effects of this if you get it or to prevent it. You have so much more than a comfort call's worth of knowledge to dispense. It's ridiculous. And watching this unfold sort of presents that relevance. The second is a story a colleague actually dropped on my desk a couple of, maybe a month or so ago now, that showed up in Time magazine. And it basically is the simple story of a lady that has a health scare. She's got chest pain, shortness of breath, checks herself into the ER, and is then sent home told that she likely has pneumonia. And this continues on. A few days later, she's feeling worse. She goes back to the ER and sent home again. And a few days later, now 7 days into the episode, she's back again, this time tested for COVID. And 3 days after that, while at home, she receives the notification that that she actually has tested positive for COVID. Along the way, she's run up almost $35,000 worth of health claims. And so here you see the importance actually from a health plan or a payer perspective of having the connection between a healthcare practitioner and a patient while they're in their own home, sort of wrestling with when and how to access the healthcare system. I mean, the cost of leaving people unattended and unsupported is extraordinary. Now, the third, and this one is more an emerging opportunity now, is as we're headed back to work, what you're seeing, and I get calls on this almost every day, is the struggle of employers, large and small, to figure out how to navigate this bizarre world of COVID testing and antibody testing and distancing and what have you, to figure out how do we get back to work. And the need for intelligent, local, professional guidance, particularly around testing, and then the decision sort of trees that flow from different test results is absolutely enormous. I would venture to imagine that most people on this call have not considered employers to be prospects for your practice, or very few of you have. But we've just entered into a window of time where your particular knowledge of both COVID and COVID testing and sort of the way to stratify a population as far as risk is concerned of COVID is enormously valuable in this moment in time. And we're going to talk a bit more about that in some of the workshops that follow. So now let's talk about what we're going to, how we've built resources to then put into your hands to make use of all of this information. And so we've done this by launching a thing called virtualpractices.org. As Jaclyn says, everything here is completely free, and it's free, quite frankly, because of companies like Emerson that have seen fit to sponsor it, enable us to, to fund what we're actually doing, because there's a great many resources here. So what we did, the entire site as you go there, and I really encourage you to go and register with it and look around, but in the COVID era section of the site, you'll find that everything sort of orbits around this thing here, which is a virtual care path that we built with, to essentially lay out very clearly both a decision tree, but also a way of bundling an episode of care, both for patients who are symptomatic as well as patients who are asymptomatic and seeking prevention. And we did this in a way, number one, to sort of show how it would look. The blue boxes, the significance of the colors, the blue boxes are encounters. And you'll find when you look at this up close that we have pre-coded the encounters for billing, either if you're contracted with payers or if you want to enable patients to submit their own claims, which we're going to talk about more in a moment. And so in doing this, it was a very interesting exercise. What you find, I've got a fair amount of experience over time in working with the bundling of episodes of care using functional and integrative medicine. And so what we found in this particular case is actually COVID lends itself quite nicely to this. And so this is an exercise not only in sort of creating a value proposition for COVID, but hopefully creating a learning opportunity that you could very easily apply these same principles to any other condition that you may, or health objective that you may have an interest in or specialize in. But what we ended up doing was we knew we needed different tools in order to equip you as a practitioner to step in and create real value in this moment. Number one, we needed a different type of intake. It needed to contemplate COVID risk factors and symptoms, but it also needed to look at lifestyle through the lens of quarantine. And the disruption of quarantine to maybe what could have been a previously very healthy lifestyle. And so we created a new intake packet, which has been now swept up and integrated into a number of the EMRs that we use in the functional and integrative world. But it's also a fillable PDF. You can download it and use it for free. We realize that there's likely not going to be access to good diagnostic testing at the time you have your first visit with a patient. And so we worked with a company that has an AI chatbot that's very beautifully trained to risk stratify COVID patients called Ask Sophie. We knew there was a need, of course, to then follow the symptoms and symptom progression of symptomatic patients, and we needed a way to do it without you having to call them on the phone. And so we worked with a company called Open Health Network to build a symptom tracking app that then sends symptoms directly to your email box. As practices have now begun to see more and more patients this way, we then work with that company to build what amounts to a dashboard where now all of these symptom tracking patients show up in a more unified view that's far more efficient. And so, creating new tools to sort of serve the moment. There's a supplement and lifestyle protocol that came out of this that I'll show you in a second. And so as the decision tree then forks, thinking for a moment on the right-hand side, the green side is the prevention pathway. We needed to add some weight and substance to that. And so we worked with a company that develops high-end home kits for testing and built something called the Lifestyle Risk Check panel, which is a little it's a little finger prick panel that has glucose and hemoglobin A1C and HSCRP and vitamin D. So all levels that are very relevant to COVID, but also are things very impacted by lifestyle intervention and can certainly be addressed remotely. There's a new tool that has since come out that's a genetic SNP panel from Toolbox Genomics that actually looks at a whole array of SNPs that are relevant either to the sort of known risk factors like blood sugar regulation and hypertension, as well as SNPs related to particular vitamins and nutrients that are known to be immune supportive. So it's another really fascinating way to engage people that are home and really wishing to exert themselves to support their own immune health and ideally prevent this. Likewise, on the active care and surveillance side, we've kind of laid out a process for doing that. Here you see the kit for the lifestyle risk check, a really slick kit that uses a serum separating card in that little blue case. You can send this, the whole panel. They let us, it's a wonderful relationship with this company. They let us actually define the targeted reference ranges and write the report more or less. And so you can get this kit for, I want to say it's $89 at lifestyleriskcheck.com. And now you have a way to kind of gain traction in that consultative relationship. Here's the respiratory resilience panel from Toolbox. And I just grabbed a couple of the little snip panels that pertain to different nutrients. But as you can see, they've organized SNPs by nutrient, but also by things like hypertension and blood sugar regulation to create both intrigue and engagement, but also real substance to the lifestyle consulting and the nutrition consulting that you would do with patients on the preventive side. And then finally, looking at these blue boxes, as you can see, everything is pre-coded, and these codes are laid out. And I'll tell you, normally I would say this is, if you weren't contracted with insurance, this is entirely a waste of time. But in the case of COVID, a number of really interesting things have happened that actually make this an unbelievably opportune time to start implementing programs with patients, charging privately for them, assuming you're not contracted with insurance, and then giving the patient the ability to recapture some of that, some if not all of that investment through insurance or third-party reimbursement that would never occur outside the world of COVID. I'm going to touch on this a little bit more in a moment. So then we created a nutrition and supplement protocol that was very interestingly done. We had a team of experts kind of come together, and this was a kind of consensus approach that stratifies the population into 4 quadrants. So high and low risk patients that are symptomatic or asymptomatic. And so there's a slightly different protocol for each. Emerson has integrated these protocols into Wellevate. So this is one of these times where, when you think about your COVID era infrastructure, obviously telehealth is a critical capability to establish, but so also is the ability to sort of transact commerce and manage the supplement adherence of patients remotely. So if you haven't set up your Wellevate account and learned in particular to use the protocols and bundles inside of Wellevate, this would be a very, very smart window of time to do that. So looking at the integration of these technology companies with these tools has been really gratifying. So in addition to Wellevate, we've had some EMR companies, Practice Better and Power to Practice and Serbo and Living Matrix, that have all integrated questionnaires and tools into those systems just to make them easier to apply. And then, of course, the Open Health Network, which has done such a fantastic job of building a symptom tracker and the symptom tracking dashboard, all of which you can find and easily navigate to these resources through virtual practices. Now I want to talk about wrapping this all together. And the analogy I like to use to talk about this and the bundling of episodes of care is thinking about the way we buy healthcare is so different than the way we're conditioned to buy everything else. If we bought cars in the way that we buy healthcare, we would just show up somewhere and just start buying pieces and parts, a carburetor and a steering wheel and a gas tank cap and a seat and a trunk and a sunroof. And we would just hope that these things magically kind of coalesce to create something that's going to take us from point A to point B. And it's if you think about that, that in the land of healthcare, people come in, they have visits, they get tests, if they can't see the pathway in front of them, literally they're sort of hoping that magically these investments in testing and supplements and visits and other interventions come together to create the solution that they want. Well, interestingly enough, a real driver of innovation in this area has been CMS, that a number of years ago said, you know what, we're kind of tired of paying by piece and part for something like a knee replacement. Instead, what we'd like to do is we'd like to bundle that episode of care from the preoperative work all the way through to rehabilitation and recovery, and put a price tag on that entire episode. And we'll say it's $48,000. And if this team that does that work can do it for $35,000, then by all means, keep the change. And if you think about what happens when you alter the model that way, you move from a system where the structure motivates every individual player, the anesthesiologist and the facility and the doctors, to optimize their own revenue, thereby driving costs through the roof. That's what the system, that structure motivates, to, in the bundled structure, the motivator is how do we basically create maximum value with maximum efficiency, because guess what? We're allowed to keep the change. And so what I'm proposing to you is that not only do payers and employers like buying healthcare this way, but so do consumers. When you want to, keep your food and utensils off the floor, you don't go to Lowe's and buy boards and sandpaper and screws and nails and a hammer. You go to IKEA and buy a table. So we're very accustomed to buying the thing that solves our problem. And it turns out that COVID is actually a great kind of training ground for us to build programs that address a particular thing and have it and are delivered in a finite, specific way for a particular price. And this is a skill set, I will tell you, that will build anti-fragility into your revenue model and into your practice going forward, because it leads you into that world of sign up and then subscribe. And so what we've done here is we've laid out a care path and the tools that are integrated. So a big part of the challenge of building a bundle, I will tell you, is thinking through, particularly to do it remotely, is to think through not only the clinical decision making, but also the necessary tools that you have to hang off of the experience to make it come together as a coherent, valuable, impressive thing to the end consumer or the patient. And so we've kind of done that in the work of building the care path. Now I want to show you when you tally this all together, what this bundle looks like. So you have your care path that lays out a method for making decisions and sort of steering the course of care. But you've also, think about what we've talked about. You have now integrated technology. You have your own time, potentially that of a coach or a nutrition professional or an allied practitioner. You have education that's very invited into this care path. It's, if you have food plans or if you have recipes or other lifestyle education on sleep, for whatever reason, we're so focused on sleep during this quarantine, bundling that in. Of course, home testing and looking at these various tools, all coming together to create a coherent, potent, valuable experience that people are very willing to pay for, not only individually, but actually employers as well. So now I want to talk about the last thing, and then we'll break and have some discussion or transition to the next part of our conversation. But the last tool that we've built that, again, would probably make in many ways no sense at all outside the context of COVID is a tool specifically designed to help you package and price. So when you build, another challenging aspect of building a bundle is the cost accounting for it. And so if you go into the back office section at virtualpractices.org, you can, in the section called packaging and pricing, you'll find that there's an Excel workbook that you can download. And there's also a video there that will teach you to use it. And we're going to dig into it in a future workshop. But what this thing does is actually a very important thing. What we did was we took the care path, we coded it as you saw, and then we show you the Medicare reimbursement rates for these various encounters. So this is, through the most economically conservative lens, a picture of the economic value of this episode of care for both the prevention and the active care and surveillance. And so what it does for you is it gives you a benchmark in your mind of the very least this could possibly be worth financially. So then, having looked at that, you move over and you have a look at this little orange bar here where you're taking the visits and you're going to do something that is quite simply time and materials cost accounting. So you're going to say, okay, for these various visits, if I'm the provider, these are how many minutes I believe it's going to take me on average. Let's say I'm working with a coach. I'm going to say it's going to take my coach these amounts of minutes. And then I go down a little bit and I say, all right, I know that I need to make this much on an hourly basis to support the practice. I need to pay the coach this much on an hourly basis and to make a profit. And so you've kind of got a sense now of the weight in terms of time and the translation of that in terms of money. And then you can go in and say, and by the way, I'm going to throw in a test kit, or I'm going to throw in an education bundle that I've developed, and you assign a value to that, and out pops a price. Now, why is this important? I will tell you it's important for two reasons. Number one is it's obvious and incredibly practical to do the time and materials cost accounting for a program of any kind that you're going to sell over and over to make sure that, in fact, it's a profitable enterprise. But the second reason that's almost as important is invariably when you put your program out into the marketplace, be it for COVID or anything else, it's inevitable that when you share it with people, someone in the group is going to say, wow, that's expensive. And knowing functional and integrative practitioners as I and we all do, that jab is uncomfortable and painful. And if you haven't done the work to understand why the price is the price, it sets you back on your heels in a way that's unnecessary. On the other hand, when you have done the work to say, I've actually done the math on this, and you know in your mind when you hear it, well, they may think that, but I actually know that this is an unbelievably reasonable price, and this is a very valuable program because I did the math. The differential in terms of confidence and your ability to respond in a level-headed way to that jab is just, it's night and day. So when you do this work, and it literally, using this workbook, it'll take you, I don't know, 10 minutes to think through what we're now talking about. The moment you've finished with it, the next tab in the book, you enter in a little bit of information about your practice, and voila, every single encounter form in the entire pathway is now pre-coded. So you'll see on this workbook a bunch of tabs. All you have to do is enter the patient information and data service. You print the workbook, hand the workbook to the patient at the end of the episode, and if they put forth a little bit of effort, they can literally go back with many, many payers and get reimbursed ahead of their deductible and even out of network, because the payers are going so far out of their way to try and protect people from further financial battery, and actually reimburse themselves for the bulk of this episode. Now, again, this is a once in a lifetime, I hope, situation that has been brought on by COVID. So don't expect this for your diabetes program or your detox programs or whatever. But with COVID, there actually is an opportunity for the price not to really be the price. It's almost like a rebate. So anyway, this is a really cool tool. And it leads me now to kind of conclude by talking about next steps. So number one, if you haven't already, register at virtualpractices.org, and you'll find all these resources, and you'll find that they are free thanks to folks like Emerson. Second, when you register, you'll be prompted to join a Facebook community. And this is where I would encourage you to accept the invitation, because this is where a lot of this dialogue is taking place. And we're getting to hear about what people are doing in the real world and sort of responding and answering questions as they come up. It's a great way to put forward questions. It's well monitored and moderated, so it's a productive and lively community. The third thing is we are now already underway. We've recorded the first one of a series of 4 follow-on workshops that dig into each of those 4 steps that I discussed in terms of building the COVID era infrastructure and creating your programs and packaging. We have an entire workshop devoted to essentially capitalizing on testing, not just COVID testing and antibody testing, but home testing and genetic testing and in different ways capitalizing on testing and frankly orienting yourself to novel ways of sample collection to create anti-fragility in your practice. And so I really encourage you to follow along with these workshops, and I trust that Emerson will have a way of reaching out to alert you to where to find them. The first one we just recorded this week, and it's available on through Emerson's site. And then lastly, as you may have heard something that you didn't write down or it caught your attention, if you have any question at all, if you'd like something sent to you that I've mentioned, if you send an email to impact@virtualpractices.org, we have folks that can respond and send you any tool or resource that you may need. So that concludes my my monologue, and I will invite Tabitha to pick up where I've left off and bring us to closure.
Great, thank you so much, Tom. I was going to see, Jaclyn, are you also going to be doing a presentation, or do you have anything you'd like to add?
No, that wraps us up. I mean, I just hope that everyone found this really helpful, and I encourage you to take advantage of a lot of this toolkit that's been built out already.
Yeah, so I just would love to, first of all, thank both of you. Tom, this is such a fabulous presentation, and just to really reorientate us to how to think about practices, and such an incredible resource for the integrative community. I really want to thank you both for helping to make this available. while I've heard pieces of these things here and there from different folks, just the breadth of this has really helped me rethink how we can start remodeling and rebuilding, as you said, Tom.
Yep.
We can take a few questions if anyone has questions from the audience. I was curious to find out, how you've seen, because we have seen in the media and I think through providers that some people are really getting pushback from even talking about any type of immune support. And have you found that in your worlds that you're having clinicians worry about that?
Well, Jaclyn, do you want to answer that? I'd be happy to chime in.
I can. I mean, I've certainly seen practitioners who have kind of more edgy or controversial information out there get censored. And controversial or edgy might be talking about IV vitamin C or the role of vitamin D in immune health. So things that are edgy from a conventional perspective. I think the biggest piece, and we also follow like FTC and FDA warning letters, which have gone out to practitioners for claims. You just have to be very careful when you're promoting anything related to COVID, that you stick with evidence-informed information, make it really clear that, there's not enough research that we can conclusively say that supplements or vitamins can prevent or treat. And I think that the conversations like Tom covered, those are great to have in your patient community, which is not a public-facing domain. So what you might say, and Tom, you tell me if you disagree, but what you might say in a email group that's closed, that's your patients, may be very different than what you post on social media. And I do encourage people to be conscientious of it. But the fact of the matter is, people want this information. They need this information. They want it. So putting yourself out there to talk about it in a way that's fair and balanced and accurate and not overstating, in my opinion, is extremely important.
Totally agree. There's actually no need to exaggerate or overstate anything right now. There's such a vacuum and void of frankly value for anyone who isn't in the hospital already. It's like all of the thought and innovation has kind of been focused on what happens once you're there. When do you intubate and use a ventilator, or do you not? In terms of the poor person like Chris Cuomo sitting at home sweating and wondering what the heck to do, there's such a vacuum of just quality information. And what I've seen is and I'm on so many mailing lists of practices that so much of this knowledge has been delivered and spilled out in the form of an email newsletter, which I would just submit that is not the best way either to deliver value to the patient or certainly to position yourself to capture anything in return. And that if you package something up that's more of a solution, it's so much better for re-engaging and reconnecting with folks. But there really is no need. I would say one area of expertise, if you haven't cultivated it already, is to really get an understanding of COVID and antibody testing. And it's a fast moving thing, but we're about to shift into away from swab testing and to salivary testing. The Rutgers has had an FDA cleared test. There's now a second one, a third is soon to come. That's going to be an abundant supply. And it's such a superior way of collecting a sample. It can be done from home. It's going to be a bit of a game changer. And so if you have not read the paper that Helen Messier put together on testing, it's on the IFM site. It's an unbelievable primer on testing to create literacy in both forms of testing, and would put you into, it would give you, and just reading that paper gives you a PhD in COVID testing that would allow you to then interface with the employer community, certainly with patients. I mean, it's just a spectacular piece of work that she did. And we're going to be talking in one of the workshops about really how do we really leverage both the availability now of testing that doesn't require you to come face to face with contagious patients, and also your knowledge of how do you make decisions on the basis of what may or may not have been learned from testing. It's a very valuable skill set that every single company that's coming back to work has got to have some application of. So anyway, it's a big deal.
Great. Yeah, Tom, if you would be willing to put that site, that link into the chat, you can do that. That would be great. Or send it to me and I can get it out to the community. People are asking for that you just mentioned.
Perfect, I will.
Great. And we do have a question coming in from Laura Ross Adams. She asks, do you think this can be implemented in an orthopedic surgery practice? Some of these shifts that you're talking about, Tom.
Boy, that's an interesting question. In an orthopedic surgery practice, you know, I will say it's funny because the bundling episode that I referenced that actually set a lot of this in motion is in the orthopedic realm. So absolutely yes. I think that again, if you think through the thought exercise, and you have to find some place to start. So maybe take your either your most common procedures or ones that might lend themselves best to this, where there is a consistent and predictable pathway that you can optimize, and think to yourself, okay, if you now assume the role of the patient and walk through that experience with you from, I think I need this procedure done, all the way through to I'm now fully recovered from it, and possibly even beyond. I mean, if you're on this call, then you obviously have a strong interest in integrative medicine. And again, let's just think of a knee replacement and the need for and the value in terms of really getting the most out of what you've just done with this procedure, the value of a smart and well-designed lifestyle indefinitely beyond that procedure is something that I think you really could probably bundle beautifully into a care path. Thinking about things like, and again, capitalizing on your training in integrative medicine, thinking about things that you could do ahead of a procedure to accelerate the recovery time, to lower risk factors, to control any kind of baseline inflammation they may have had before coming in. There's probably a ton that you could do. And so, yes, I would definitely think about that. In terms of application of this to COVID in a practice, I'm not so sure, but certainly for the core work that you're doing, these principles are beautifully suited to that line of work.
Wonderful. Let's see, are there any other questions? Great, we took that one. Jaclyn, I'm wondering, just from your practice, how have you been able to shift, beyond just a telemedicine model and implement some of these types of changes?
That's a great question. So my practice was virtual to begin with, and I've actually been busier during this time than I ever have been. I think partly because it's virtual, and also because my specialty is fertility, and most fertility clinics closed for a period of time, and people wanted to take that opportunity to be proactive and really do something positive for their health in the meantime while they were waiting, or search for alternatives if they were waiting in an IVF cycle. That being said, I also do coaching and mentorship for a group of doctors, many of whom have in-person practices and have done everything from completely shutting down because they have kids to care for, through trying to pivot and make these changes. And I think the biggest takeaway I've taken from Tom's presentations and work that I'm already starting to implement is packaging, and really creating a system where it's not just a one-time visit that they pay for, but an entire system or a couple months of care that they end up paying for. So that's in development for me, and I'm about to launch that. But I think that's probably one of the easiest transitions that an integrative provider can make, because all it is bundling things you're already doing and having patients make a commitment up front. And I actually really like that, because, and I think my patients like that, because they know exactly what's involved and what they're going to get. So there's a lot of people that are doing that really well right now. Like one website that you could take a look at to see how they communicate things that you're already doing would be like Parsley Health. Tom, is that one that you're familiar with?
Oh, yeah, sure.
I mean, they have a membership model, but if you read the things that they list as what you get with membership, one of them is like, you get written recommendations and written prescriptions. And I'm like, well, doesn't every doctor do written prescriptions? But they sell it as an added benefit of being a member. And I think there's a lot of the languaging, like we do so much, reviewing old lab records, what are all the things that you're already doing that you aren't accounting for, or you aren't specifying the value of with your patients, and how can you make sure that you include that to really show the value of the care you're providing, because it is a higher price commitment up front, you know, that you want to really let them know everything that they're getting. Maybe it's access to emails through you during that period of time. Most people are doing that anyway, but not being compensated for it. So you might as well allow that to be part of what you're offering and add a value to it. This is an insurance billing, like Tom's mentioning. I think with COVID specifically, people are starting to get back into practice. And like he mentioned, the fact that there's an opportunity for reimbursement for these services in times where there may not normally be for that state or practitioner type or that service is absolutely huge right now, and a real opportunity to kind of make that pivot.
Great. Well, we are out of time, and I just really want to thank both of you. This was such a fantastic presentation for our community. And as you all know, we live stream these on Facebook. We also, you can go to our YouTube after and rewatch the videos there. We upload them within a few days. Please, next week, join us on Mondays. We have our Monday meditations every week. Dr. Rachel Abrams will be leading us this coming Monday. And next week's wellness webinar will be featuring Shamini Jain from the Chi Consciousness Initiative that we're really excited to, they've just put out a big biofields white paper. And so she'll be talking about that. And hopefully, Tom and Jaclyn, we can have you in the future. Jaclyn is an AIHM fellow in the fellowship program that we have here. And so, yeah, let's keep learning from you all. And thanks again for providing all these resources.
All right. Thanks for having us.
All right. Have a great one, everyone. Great weekend.
Bye.